Hi, my name is Sarah Sugar, and I will be talking about my internship experience at Onslow Memorial Hospital and Onslow County Health Department, both located in Jacksonville, North Carolina. I'm going to start first with OMH, where I did my internship on Tuesdays and Thursdays. So, the mission of Onslow Memorial is to provide excellent patient health services in a healing and family centered environment. At OMH, the clinical staff, non-clinical staff, healthcare providers, and volunteers partner together with patients and their families to support the patient experience. They aim to support the following patient and family-centered care principles: dignity and respect, collaboration, participation, and information sharing. OMH is a 162-bed acute care community hospital serving the city of Jacksonville and Greater Onslow County. Typically, the patients they see are sick, but anyone can walk through the doors and ask for help for any reason. The hospital is structured through clinical staff, non-clinical staff, providers, administrators, and volunteers, all working together to help others through a patient and family-centered philosophy. OMH is a standalone, nonprofit, charitable organization that receives no funding from Onslow County taxpayers. My responsibilities at the hospital, I was able to assist with community outreach as it relates to the community health needs assessment and improvement plans, assist with the data collection with the 2021 community health needs assessment, participate in community outreach program development, support infection prevention awareness, education, and activities at OMH, and deliver health education and promotion as designed by the hospital. For the first month or so, on my days at OMH, I was able to shadow different health professionals within the field of public health. This was neat because I was able to see how the degree of public health was used in the workforce and the positions I liked and didn't like. I also distributed community health needs assessment surveys to clinics associated with the hospital and researched different places in Onslow County that would be good to target specific demographics. And lastly, my biggest project was creating a COPD education outreach that was later turned into multiple outreaches and was combined then with stroke prevention. And this slide is just a visual of the materials I created for COPD and the table set up for the outreaches. While working at the hospital, these were the in-check competencies and staff public health domains that were addressed the most. These competencies were met through reaching out to professionals related to COPD, accessing existing information of previous outreach materials, collecting primary data as it pertains to location, hours, and materials of organizations involving priority populations, and assessing the needs for outreach materials and involving partners when communicating information as it pertains to the COPD project. When implementing my project, I had to take into consideration the needs and resources of the population I was trying to reach and assisting with education materials and distribution through outreach events. For the COPD outreach, I've created multiple sources for people to get their information, such as flyers, infographics, and promotions. At the hospital, the most important thing that I learned that took place for me was getting to network with different professionals in the hospital and getting to learn more about all the opportunities that coincide with public health. What I had liked the least when shadowing some professionals was if I knew right away that I did not like the position and was uninterested, the day could feel like a waste even though I did get to learn what I didn't like. What I enjoyed the most was my ability to split my internship between the hospital and the health department to see the two different sides of public health. And lastly, the most memorable experience would be my COPD education outreach because I was able to see it grow with each event I did. So now I'm going to transition into my other site, which is the Onslow County Health Department, where I worked on Monday, Wednesday, and Friday. The mission of Onslow County Health Department and the Consolidated Human Services is to deliver supportive social, economic, protective, and health services that build better lives for individuals and their families. They aim for strategic and effective communication to integrate consolidated human services programs, assure a well trained and diverse workforce, and work culture that is cooperative, inclusive, diverse, respectful, and culturally competent, and for the community collaboration, partnerships, and engagement. The Health Department is one of three services that fall under the Consolidated Human Services. And at the health department, there are over 130 employees, specialist staffs, RN, mid level providers, lab technicians, nutritionists, dietitians, social workers, environmental health specialists, soil scientists, health educators, preparedness coordinators, marketing, accreditation, processing assistants who perform a variety of tasks, and administrative and support staff. In my internship, I worked directly with the community relations team. So, the community relations team is made up of one community relations officer, one quality assurance coordinator, one emergency preparedness coordinator, and three health educators. The health department is funded by being a for profit agency and is an equal opportunity provider and does not discriminate against anyone because of race, color, religion, national origin, citizenship status, or disability status. Their focus is on the betterment of the community. At the health department, I was responsible for assisting in COVID-19 response through education and awareness, development of educational materials for projects and programs related to the community health improvement plans, updating the 2021 Nutrition Resource Guide, delivering health education and promotion as designed by the health department, and assisting with data collection relating to the 2021 Community Health Needs Assessment. Through my time here, I've been able to work on multiple projects, including a monthly newsletter that I did on mental health in the workplace, a barbershop outreach to give condoms to prevent the spread of STDs in Onslow County, updating the nutrition resource guide, and making a community bulletin board, and participating in the MedJob project. And this slide is just a visual of the materials I created for the MedJob project and the bulletin boards I set up. While working at the health department, these were the competencies and domains that were addressed the most. These competencies were met through reaching out to local pharmacies and existing locations for MedDrop, accessing existing information of previous outreach materials, collecting primary data as it pertains to the location, hours, and materials of organizations, involving priority populations and assessing the needs for outreach materials, and involving partners when communicating information as it pertains to the MedJob project. When implementing my project, I had to take into consideration the needs and resources of the populations I was trying to reach, assisting with education materials and distribution throughout the outreach events. With the MedJob project, I have created multiple sources for people to get their information through flyers, infographics, social media, bag tags, and bulletin boards. At the health department, the most important learning that took place was getting out of my comfort zone and talking to people either in person or over the phone. I'm naturally an introverted person, so it was helpful to use this internship opportunity to grow as an individual, both personally and professionally, by gaining confidence when engaging with others. What I liked the least about my time at the health department was that in the beginning, it was a bit difficult to get acquainted with the team and to know what to do because there was no clear directions given to the interns. However, as time went on, projects and daily tasks were easily identified. What I liked the most, again, would be the opportunity I had to split my internship between the hospital and the health department. And lastly, my most memorable experience would be working on the MedJob project. In all, I thoroughly enjoyed my internship experience at both the hospital and the health department. I was able to see the public health from two different perspectives and learn what I liked and did not like. Therefore, I would say that this internship was a success and helpful in identifying how I want to further my career in public health. Thank you.